understanding and managing common NBA injuries, an in-depth guide, and also discuss NBA MVP Joel Embiid's injury. Hello, everyone. Welcome back to MD Talk Health and Fitness. If you're an NBA enthusiast, today's episode is designed just for you. We'll be discussing some common injuries NBA athletes face, how they occur, and the steps taken to diagnose and treat them. Let's jump right in. The high-impact nature of basketball, especially at the NBA level, puts athletes at risk for certain injuries. We're going to look at 3 of the most common ones: ACL tears, ankle sprains, and jumper's knee. But first let's discuss. Today, we're going to focus on a specific injury that sidelined one of the NBA's most dominant players, Joel Embiid, during the playoffs. Embiid suffered a tear to his LCL, or lateral collateral ligament. The LCL is one of the 4 main ligaments in the knee, and it's located on the outer side. It provides stability and limits sideways motion. Athletes like Embiid can injure their LCL from a direct blow to the inside of the knee or from twisting or bending the knee excessively. An LCL tear can cause pain, swelling, and instability in the knee. It can be difficult to bear weight on the affected side. Doctors usually diagnose an LCL injury with a physical examination, where they'll check the knee's range of motion and stability. Imaging tests, such as an MRI, can confirm the diagnosis and the extent of the injury. Treatment for an LCL tear, like Embiid's, depends on its severity. Mild to moderate sprains often heal with rest, ice, compression, and elevation, alongside physiotherapy to restore strength and mobility. However, severe tears may require surgery to repair the ligament, followed by a rigorous rehabilitation program. Joel Embiid's road to recovery was closely monitored, involving a team of medical professionals, coaches, and trainers to ensure a safe return to the game. His dedication and resilience throughout his rehabilitation were truly commendable. ACL, or anterior cruciate ligament, tears are quite common in the NBA. The ACL is a ligament that helps stabilize the knee. Athletes can tear their ACL when they stop suddenly, change direction quickly, or land after a jump, moves that basketball players frequently make. Some famous examples include derekrose in 2012 and Klaythompson in 2019. An ACL tear can be diagnosed with a physical exam and imaging tests like an MRI. The athlete may hear a pop at the time of injury, and the knee usually swells, becomes painful, and difficult to move. Treatment for an ACL tear often involves surgery, followed by a long period of physiotherapy to regain strength and mobility in the knee. Next up is the ankle sprain, an injury that happens when the ankle ligaments are stretched or torn. Quick pivots or awkward landings can lead to this injury. For instance, Steph Curry has dealt with repeated ankle sprains throughout his career. Symptoms include pain, swelling, bruising, and difficulties in moving the ankle. Diagnosis is usually through a physical examination and sometimes an X-ray or MRI to rule out fractures. Treatment involves rest, ice, compression, and elevation, often abbreviated as RICE, and rehabilitation exercises to strengthen the ankle and prevent future sprains. Our last common injury is patellar tendonitis, also known as jumper's knee. This is an overuse injury from repetitive jumping or running. NBA legend Vince Carter struggled with this condition in his career. jumper's knee can cause pain and swelling just below the kneecap. Doctors diagnose it using physical exams, ultrasound, or MRI scans. Treatment usually involves physiotherapy to strengthen the muscles around the knee, anti-inflammatory medication, and sometimes, in severe cases, surgery. Remember, if you're playing basketball or any other sport, it's crucial to warm up properly, use the correct technique, and listen to your body to avoid these and other injuries. Always consult with a healthcare professional if you have any concerns. That's it for today's episode on MD Talk Health and Fitness. Please like, share, and subscribe for more health and fitness.